there are a lot of folks who are hesitant or outright disinterested in getting a vaccine. I have two things that I think are important to note. The first is if you've got questions, my job is to get you answers. Our job as a public health community is to get you answers. And folks should not be afraid or feel that if they ask a legitimate, earnest question, they will get ridiculed or that they will get shamed. One of the things that I've tried to do throughout the pandemic is to recognize that everyone comes to a health discussion differently. And whether it's masking, physical distancing, treatment, or now vaccines, everyone comes to that discussion with a different worldview and different experiences. And if we take people who have honest, legitimate questions, shame them, shun them, or yell at them, they put up a wall. And then that's it. There is no further conversation. So my first message is, if you're interested in a vaccine, but you've got questions, it's safe, is it effective, do I need it, will it harm me, will it harm my kids, you should ask those. You can ask us at Maine CDC. We've been trying to do videos and FAQs. You can ask your doctor. There's so many people you can ask. But I would ask, I wouldn't necessarily go to the internet first unless you're going to the CDC website. That's the first thing. The second is that I understand where that sentiment comes from. Again, folks come to the table with different worldviews. At the same time, it's right and legitimate to ask questions. I think it's important to consider where we are. We're in a pandemic where 750 people in Maine have died. More cases are being diagnosed every day. Over 100 people are in the hospital yesterday. Many of them are skewing younger now. So it's also important to remember that while getting your questions answered is critical, we're still in the midst of a pretty serious pandemic. And so there's an urgency to getting those questions answered. Yeah, Joe.
I'll go ahead and just a couple quick ones. Is the New Hampshire lifting the mask mandate, could that possibly have any bearing in the future on the exempt status for travel? And then I'll ask my follow-up is, Bloomberg News vaccine tracker has Maine as the top state in the nation for how quickly we're vaccinating people fully vaccinated, and we're second in the nation for getting the first dose.
Yep.
And is there any thing that Maine is doing that you can point to that's different in other states and why we're doing it faster?
Yeah, so I'm glad you raised that. I'm going to start with your second question, Joe. Joe is right. As of at least yesterday when I checked, the Bloomberg News vaccination tracker has Maine as the top state in the country right now in the #1 position in terms of the percentage of our population that has received all the shots they need. And as Joe notes, we're in the #2 slot in the percentage of our population that's gotten at least their first dose. I'm really proud of that. I can't underscore that enough. I'm really proud of that. And Joe, I think some of the secrets to our performance thus far are #1, credit goes to Maine people, right? You can't get X percentage of your population fully vaccinated unless X percent of your population wants to be fully vaccinated. And at a time when other states across the country, from Alaska to Mississippi, are running into walls of hesitancy, to the earlier question, we're not seeing that. We're seeing urgency in Maine. So credit right now, first and foremost, goes to Maine people who wish to get vaccinated. The second, however, element of credit goes to the approach that Governor Mills pushed forward with, which is one that ensured that we could have efficiency in our distribution as well as maintaining equity. Now, we've got more work to do on the equity front. We've got more work to do on the efficiency front. But I think the system that we've set up, which relies on a strong partnership with healthcare systems, as well as the movement of doses around the state every single day to ensure that there's a supply and demand consistency, those are, I think, the things that have gotten us where we are. In terms of your former question around New Hampshire, I don't see Governor Sununu's move right now as affecting our policy. We don't have any plans right now or we don't have any plans, period, to change our view of masking, physical distancing, et cetera.
I understand that you work on the state's website now, to the point where you actually can go online and make your reservation and get a shot from you. Can you comment on that? It's gonna be a-
We can. Yeah, a couple of days ago, we are at the point now where it is possible for Maine people to go to the state of Maine's website to schedule an appointment, but some very important qualifications there. This is not an appointment for each and every site across Maine. It is for sites that have opted to use our scheduling platform, or for some sites that appear on our platform, but when you click on it, you actually get taken to their scheduling platform. So, but I'm proud that we're here, because even though we have made great progress in getting folks vaccinated, we still have a ways to go. And the way we will continue to get there is by bringing additional clinics online. I don't know that those additional clinics will be of the nature of the expo, for example. They may be smaller, they may be at a school gym, they may be for 2 Saturdays a month. And what we've heard repeatedly from groups like independent pharmacists, they've said, we want to be doing those clinics, but boy, scheduling is a bear. We're great at vaccinating, we're great at record keeping, but scheduling, that's not their bailiwick. So this platform will help us put clinics online there, and then when those groups come into being, we can use that as a scheduling platform. But right now, that scheduling platform, it's not for nothing. You can schedule your vaccines at the Maine General site at the Augusta Civic Center, as well as the FEMA mobile unit sites that we are going to be taking, we're doing a tour around the state on. And we're going to be adding more sites in the coming days.
I know you talked about this, but people traveling for spring break or the break, what advice would you give them in terms of what to do, what not to do?
Yep. I think when folks are going on vacation with their families, it's less about where you're going and more about what you're doing when you're there. So what I recommend is that irrespective of where you're going for your spring break, go about your day the same way that you probably would here in Maine. Wear your mask, avoid crowds, avoid gatherings. When you're going out to eat, try not to be crowded in a busy dining room. Try to find a spot that's off. If you can get your food and go outside and sit in the park and eat, that's even safer. So I think the advice that I would offer folks is focus less on where you are and more about what you're doing. And the things that you would be normally doing to keep your family safe here in Maine, those should be the same things that you're doing when you're on break, whether you're at Disney World, whether you're hiking the Grand Canyon, whatever the case may be, or even hanging out at Acadia. No matter where you are, do the same things that you'd be doing anyways. I think I got time for one really quick last question. Okay. Well, hey, thanks everyone. Oh, yeah.
How are the Dr. Shaw candy bar sales going? And is the Dr. Shaw miracle elixir ready to go?
I gotta say, it is. I've said this before, but I've been reflecting on it a lot lately. If you think about it, I'm a guy with a funny name and didn't grow up in Maine. I've only lived here for 20 months at this point. And in the course of the pandemic, the support that people across the state of Maine have shown to me, my family, my team at the Maine CDC has been nothing short of gratifying. And I think that says a lot more about the character of Maine people than it does about me or anybody else. And I think you see that in our numbers. I'm not saying this for nothing. I think you see that in our numbers. There is, I think, a link between the fact that our infection rates are among the lowest in the country. Our hospitalization rates are among the lowest in the country, despite our older population. And our vaccination rates are the highest in the country. That's not an accident, right? And it's not because of me. It's not because we've got a good website. It's because people in Maine care about these things. Science means something here. And I think when you take that as your starting premise, the support that people have shown us makes complete sense. So it's quite gratifying.